Ventral or abdominal hernia is a condition during which contents of the abdomen, such as intestines, can protrude through a defect in the abdominal wall. During ventral hernia, a certain area of internal layer of the abdominal wall can weaken and subsequently tear, leading to a protrusion. Since the contents of the abdominal cavity are normally under pressure and are held together by musculature of the abdominal wall as well as a strong tissue layer called fascia, any tear in the fascia or muscle will lead to a formation of a hernia. Ventral hernias can occur most commonly in the belly button area, which is the weakest part of the abdominal wall. A ventral hernia in the belly button area is called umbilical hernia. Ventral hernias can also develop anywhere in the abdomen, including the center of the abdomen and its sides. Frequently, ventral hernias can develop in the areas of prior surgical incision in the abdomen. In that case, they are called incisional hernias. Most frequent symptoms of ventral hernia are pain, discomfort, and swelling in the area of the hernia. Sometimes patients feel that they can push the hernia in and it comes back out. Certain other conditions can mimic a ventral hernia. For example, a large bulge in the center of the abdomen can be caused by a separation of muscles in the midline, called the diastasis of the muscles. Although this condition can also result in a bulge, there is no hernia and no treatment is needed. It is important to have a thorough examination by a hernia specialist to properly diagnose a ventral hernia. Frequently, imaging studies such as CAT scan, MRI, or ultrasound are needed to help with the diagnosis of a hernia and to plan a proper treatment. Ventral hernia can result in several complications. A segment of the intestine can become trapped in the hernia with the resultant damage to the intestine and formation of intestinal blockage. This condition is called incarcerated or strangulated hernia, and it will require an urgent surgery. If left untreated, hernia can also increase in size over time and become very uncomfortable. Ventral hernia can affect musculature of the abdomen and back and result in chronic back pain and limited mobility. Generally, all ventral hernias are recommended to be repaired to avoid complications. Methods of hernia repair vary depending on the hernia size and its location on the abdomen. Smaller, uncomplicated hernias are most frequently repaired laparoscopically using a camera and tiny incisions with or without utilization of a mesh. Larger hernias may require an open procedure with realignment of abdominal muscles called a component separation technique. Can hernias come back after repair, and what can be done to reduce the risk of hernia recurrence? While modern hernia repair techniques are very sophisticated and reliable, hernias can recur months or even years after surgery. Patients who are overweight or smokers have a much higher chance of hernia recurrence. Therefore, it is mandatory that patients lose as much of their excessive weight as possible and quit smoking before their ventral hernia procedure. If you have any questions regarding ventral hernias, please do not hesitate to contact our office. Thank you.